be talking about the disadvantages that low-income students experience when it comes to mental health. I would like to present this speech to an audience of legislators passing a bill to increase funding for mental health resources in public schools and pediatric care. So first, I would like to present some research and also frame the problem of this mental health crisis, one might say. So to frame the problem, worldwide, more than 70% of young people and adults with mental illness do not receive any mental health treatment. According to the National Center for Children in Poverty, approximately 20% of adolescents have a diagnosable mental health disorder. That's about 100 people at my school. However, 70 people out of those 100 would not seek help. So there are a couple reasons for why people don't seek help, according to the American Pediatric Journal. First reason is lack of knowledge about features and treatability of mental illnesses. Second, ignorance about how to access assessment and treatment. Third, prejudice against people who have mental illness. And fourth, expectations of discrimination against people who have a diagnosis of mental illness. So more specifically, children experiencing poverty are less likely to seek treatment due to a variety of factors. In America, children under 18 are disproportionately affected by poverty, making up 23% of total population, but 33% of all people in poverty. In 2014, 20% of all children lived in low-income households. Furthermore, although the largest number of poor and low-income children are white, minority children are disproportionately affected, particularly African Americans, Native Americans, and Hispanic children. In 2013, Hispanic and African American children were about 3 times more likely than white and Asian children to be poor. In this case, cultural and class issues highlight that it's more likely for these children to be at risk for mental health issues. According to an article from Pediatric, the official journal of the American Academy of Pediatrics, quote, children of low socioeconomic status experience higher rates of parent-reported mental health problems and higher rates of unmet mental health needs. Lower-income children are exposed to higher rates of stress, and over time, the effects of early and chronic exposure to stressors can cause vulnerabilities, including physiological disruptions and changes in brain architecture and functioning, which can lead to negative long-term physical and mental health consequences. Early intervention in schools can be key in this case to avoid long-term consequences. Additionally, family relationships can be put under strain because low-income parents are also exposed to more stressors which can affect their relationship with their children. The stigma of mental health treatment and the stigma of living in poverty can engender self-blame and self-loathing, which can inhibit families from seeking care in families that are experiencing poverty. Among children experiencing poverty who are in need of mental health care, less than 15% receive services and even fewer complete treatment. According to the same pediatric article, no significant difference in the prevalence of mental health problems among children residing in poverty by race or ethnicity. However, there are statistically significant disparities in mental health service utilization across racial and ethnic groups. Studies have generally found lower mental health service utilization among African American and Hispanic children compared with white children. When it comes to treatment, public treatment, as in hospitals and going to the ER, the American Journal of Public Health has found that treatment in public agencies is related inversely to class position. The lower the class, the greater the proportion of patients treated in public agencies. And when it comes to private treatment, which would be like therapy or individual treatment that is not funded from hospitals, would be number of times the same article has found that the number of times patients see their therapist per month is significantly different from one class to another. The higher classes receive more frequent treatments than the lower classes. This is a class issue that also affects people of color and minorities that are affected adversely by poverty. So when it comes to destigmatization, funding schools will help with destigmatizing mental health issues. From the Stigmatization Journal of Public Health article, they found that mental health knowledge predicted intentions to seek help for mental illness and to disclose such an illness to family and friends. This emphasizes the importance of mental health literacy. In order to increase funding for more mental health literacy within public schools with a higher proportion of students experiencing poverty would be beneficial for students who have mental health issues. From the same pediatric article, it's been found that children and families living in poverty face a range of barriers that reduce their ability to access mental health services. Additionally, lack of insurance and quantity of mental health services provided under managed care plans can prevent children and families from accessing needed mental health care services. When it comes to pediatric primary care doctors, the Pediatric Society has found that integrating mental health services into existing service settings, including pediatric primary care and in schools, is the most promising means of increasing access to mental health care, particularly for children from lower income families. It's incredibly important to create a safe space where children can voice their needs so that they won't be adversely affected in the future, which was found that poverty can lead to negative long-term physical and mental health consequences. An example of implementation of destigmatization and funding for schools would be from a school in Loveland, Colorado. In 2016, they received extra funding from Title I, a program that allocates money towards schools that have high levels of low-income students. The principal decided to use that money to improve mental health resources, making a half-time counselor full-time, designating 20 minutes daily to a social and emotional health curriculum, and having the mental health staff meet with the principal weekly to discuss existing student mental health issues. This has resulted in the school at an over 50% reduction in discipline. When it comes to in-school suspensions and out-of-school suspensions, it's about a 75 to 80% reduction. Early intervention is key when it comes to mental health problems, and funding for schools and pediatric doctors will help reduce the effects of mental health disorders in the future. From the article, schools in poor areas have more students with mental health needs in the Atlantic. Intervening early can help children deal with stresses related to poverty, before the symptoms progress to a point that requires intensified care. The stress and violence that children in poverty experience, not a general predisposition to mental illness, requires that they be treated before their illness becomes too much to handle with talk therapy. So, in conclusion, it's very important for us to destigmatize mental health. We can do this by increasing mental health literacy in schools, resources for students in poverty, and this can help decrease the chance of long-term physical and mental health consequences for children that are experiencing poverty.
Yeah.
No.
Questions?
I think probably my biggest question is just kind of curiosity. So I could see, like, if I was thinking of the idea, the connection between minority students or kind of different races and mental health. But how did you come up with how did you personally think of doing the lower income to mental health idea? Because I found that super fascinating.
Yeah, so I struggled with mental health in high school, and I've been fortunate enough to be able to get help, been gotten testing, and I have access to therapy, and I thought, because I go to Blake, of course, high income school, and I've been fortunate enough to be able to get these resources, and I thought, similar to what you said in your thing, that that I'd like to examine how lower income students, how I can help lower income students get the resources that I have.
Yeah, for sure. All right, Adrian.
Yeah, I feel like it is an important and pertinent topic. I often have trouble coming up with questions, and this is one such time. So,
This ended.
yeah, you covered a lot really well. So.
All right, awesome. Very good.